Hi, my name is Craig Miller, and I'm one of the mental health coordinators for the Lenawee County, Michigan Critical Stress Debriefing Management Team. We meet with first responders or healthcare professionals with groups or individuals, providing debriefing after traumatic events. As a former EMT and firefighter and currently a mental health professional that have worked in hospitals and currently with an outpatient with Masterpiece Counseling in Tecumseh, Michigan, I was asked to briefly talk about how our job experiences affect our mind and body functioning. And basically, so you don't have to take the stress home with you. You see, let's start out with saying with normal amount of stress, with a packed day that's work and a busy day with family and work and other daily events, our brain can appropriately process all the sensory information, such as sights and sounds and smells and feelings that are integrated into your mind for appropriate reactions for that daily event. But as a professional on the front lines, you are routinely involved in crisis events, and it's normal to have these routine rushes of adrenaline pushing all your senses into a heightened level of performance. When you have excessive amounts of sensory information, such as events or patients that are disturbing or critical or life-threatening or prolonged suffering, maybe child-related, and you're feeling pressured and overwhelmed, your adrenaline and all your senses become heightened and overloads your mind, suppressing these senses to allow you to then go into autopilot so you can get the job done. But I need to emphasize that the prolonged suppression of these intense sights, sounds, and smells and emotions will push your mind and body systems to the max as you suppress that, and it creates a weakened state of functioning. It stresses out your immune system and increases susceptibility to illness. In fact, your body may begin to react with things such as increasing anxiety, racing mind, body tension, irritability, sleep disturbances, maybe withdrawing from people socially, headaches, just beginning of headaches, and increased consumption of alcohol or food. And because of the work hours and your shift times and the amount or type of experiences you have, you begin to think and interpret these symptoms as part of your normal results of working. But I'm here to tell you that these symptoms are not supposed to be normal. So you see, if you continue to allow them to be normal, you become more susceptible to other and increased mind and body conditions, such as depression and migraines, increasing anxiety and maybe some panic attacks, sleep issues, and then heart and digestive conditions, and many other medical and emotional conditions. You see, it's important to know that stress is a factor in 75% of our illness and diseases. And I once saw a quote that the U.S. Center for Disease Control reported that 85% of our physical ailments have a psychological root. That is a lot. So it's a fact that stressful experiences we deal with have an effect on us. And you may not have a choice what type of stressful experience you come in contact with, but you have a choice what to do with the stress after the experience. And that choice can determine your level of health. Like the old saying, what comes in must come out. And from my 42 years of experience, I can say with certainty that if you choose not to release the sensory overload inside of you, your mind and body will do it for you in ways you're not going to like. So here are some steps that you can take to maintain your health. After you're off autopilot or off your shift or leave your office or leave the incident, it's important to talk about those experiences, either with a colleague, a trusted friend, or even as you're driving home by yourself. Driving home before you get home with your family is the best way to talk out loud about your experience. It really doesn't matter how you talk about it. Talk it out loud to yourself, talk to your dashboard, or some people talk out loud in prayer. Whatever it takes to be healthy, you need to do it. So however, though, I do recommend not to talk to your spouse unless they work in a similar profession. So when you release your experiences, to talk about your experiences, I recommend you say them out loud using these following things. Number one, describe the experience. Just talk about that experience. Number two, your role in the experience. Was it direct care? Did you assist? Or did you observe? Number three, your reaction to the experience. Was it shocking, surprising? Did it make you angry? And the last one, do you believe you did everything you could? So number one, describe the experience, your role, your reaction. Did you do all that you could? So again, your experience, your role, your reaction. Did you do everything you could? Because I can assure you that you did everything you could to the best of your ability as a professional with an abnormal event. That is why you became a professional in this profession, to do your best. The key is you want to release your experiences out loud as often as you need to decrease the stress you have within. If you are experiencing continued higher levels of anxiety or racing mind, body tension, irritability, sleep disturbances, more than usual alcohol, food, it is confirmation that you have greater accumulation of stress from a suppressed experiences that are not normal to live with. You should consider talking with someone about your experiences and reactions. If you are a first responder or a healthcare professional and you'd like to speak further with a CISM team member for individual debriefing or counseling or group debriefing with the members at a station or department, especially after experiencing a critical case or traumatic event, for Lenawee County, Michigan, you can contact the Lenawee County Central Dispatch. For anyone outside of Lenawee County, you can contact the Community Information Line 211 and they will direct you to where you need to go for that need. Remember, you will work at your best when you care for yourself. Thank you.